It's a great joy to be introduced by, I guess I don't need that one. It's a great joy to be introduced by one of your favorite humans. And Camille is certainly that for me. She has been an amazing member of my team, and she continues to lead on behalf of the children of California. And I'm very grateful for her hard work. Way back in the day, we did have a Universal Preschool Task Force. It convened in 1997, and the report came out in 1998. We dreamed that within 10 years, we would have universal preschool in California. So the way I look at it, we're 7 years behind schedule right now. The fact is, though, when Rob Reiner started circulating the petition for First Five, he came to me, and there were members of our team, not Camille, but there were members of our team who said, "Don't get behind it, it's got flaws, it's not perfect." And I always like the phrase, "Don't make the perfect the enemy of the good." And so, in fact, this has been a very good idea and a great thing for California children. And I thank Rob Reiner for what he did. You know, to see this engaged group, and I know a few of you have left to drive to Mendocino and different places, but the fact is, I'm just thrilled to be here to see the Department of Education, the Department of California Health and Human Services, California Departments of Public Health and Developmental Services, Veterans Affairs, and the California Community College Chancellor's Office. It makes me want to pinch myself. You're all here together, and that's so important to me. And yet, I really do have to reflect a little bit that we aren't further down the trail, down the path to universal preschool, universal child development, and much more comprehensive support for the children of California. For heaven's sakes, several very conservative states with Republican governors, can you say Georgia, can you say Oklahoma, can you say Indiana, are actually ahead of California this afternoon in terms of universal preschool and support for the youngest among us. And I say it's time for California to lead again. It is time for us to be together and work together and change things together for the children of this state. Now, let me just say, I'm not crazy. The business community gets it. The fact is, Lily Morgue in EdSource, writing in 2013, quote, says this: at least one business organization in 49 of the 50 states has taken at least one concrete action to support early childhood education in the last year, according to a recent survey by the national bipartisan advocacy group America's Promise Alliance. Businesses reported actions from issuing opinion pieces to local newspapers in support of early education, to joining a coalition such as the Preschool Business Advisory Council in California in advocating for early education funding with state lawmakers. More than 300 business leaders in the state have signed a letter to President Obama to bring more emphasis on preschool. The letter was signed by these really giant leaders like the president of Macy's and Procter & Gamble. Listen to what they said in their letter, and I quote, "We see other countries investing in their young children, both for the long-term benefits of a stronger workforce and the current benefits that come from enhancing the productivity of parents. To compete, we must do the same," end quote. And then we find retired military generals and admirals who have joined this conversation in urging American government to engage in high-quality early education that as being important to national security. Listen to this. Retired Rear Admiral Ronnie Froman from San Diego writes this: "I am worried about the cost of government, but if we want our kids to succeed, we're going to have to pay the price," end quote. So we must begin a conversation about what we're doing not being an expense, but an investment. Now, I have to tell you, many of you have heard me say, and I will say till my dying day, that budgets are statements of values. Budgets are statements of values. And so you can imagine my dismay when I hear everybody singing the praises of how far we moved the needle in terms of K-12 funding this last couple of years. Ladies and gentlemen, We restored the $13 billion that were taken from schools, using the schools as if they were a piggy bank in California, and that was just wrong. The money that was restored brought us from 50th in per pupil spending to 46th. We spend 71% of what the average state in America spends. This, the state that used to be 5th of the 50 states in per pupil spending when I graduated from high school. The reality is that what we know about K-12, yes, but about preschool and child development, what we know about the importance of higher education, seems to be lost on the policymakers of California. The truth is that we spend 71% of what the rest of the country is spending. Do you realize not just New York and New Jersey are spending twice per student what California is spending, but so is Alaska, so is Wyoming, and Vermont, and New Hampshire, and a host of other states. We are so far down compared to where we used to be. You know, I will just tell you all, if you haven't read the Constitution lately of the state of California, you might just focus in on Article 16, Section 8, which says that the first priority of the state of California shall be the education of children through college. There's too many people in Sacramento that do not know that's in the state constitution, a document they take an oath to uphold. I had a legislator tell me, well, Delaine, you know, we couldn't give any more money to schools because we have to balance, you know, we got police and fire and, you know, roads and water. And I said, but the Constitution says the first priority shall be the education of children through college. And he looked at me and he said, does it really say that? It would be funny if it weren't so sad. And so I will just tell you that I've had an epiphany. My oldest friend is one of those people that moved to Texas. And she's living near Austin, and she took me to the LBJ Ranch. I will tell you all, I sort of haven't gotten over the Vietnam War when I went there, and I was pretty grumpy about LBJ. And then I went on this tour of the ranch, and I was quite moved. You know, when he was 4 years old, his mother took him by the hand to the little one-room schoolhouse and asked the teacher if she would let him start school. He was, after all, able to read, even though he was only 4. And the teacher said, show me. And so LBJ, she picked a book. LBJ read the book to her. And she said, all right, I'll let your son start school at age 4. Later, Lyndon Johnson observed that that ability to start school at age 4 had given him a head start on learning. And that was why he proposed Head Start. The fact is, his first job out of college was as a teacher. He taught some of the poorest kids in Texas. And he came away with an epiphany that education had not only changed his life, but the lives of so many others. So I'm really hopeful, and I'm excited about the panel I'm about to introduce, but I'm really hopeful that when we walk out of here today, this is not the end of something. This is the beginning of something. Something big and strong and powerful that puts all of the agencies that have joined here today together with every kind of local and nonprofit organization we can think of, put us together and help us work together. Many of you heard the old adage that if I gave anybody in here 20 pencils one at a time, anybody practically in the room could break them all. But if I gave you 20 pencils together, the strongest man or woman in this room could not break them. This can't be just a one-time coming together. This must become a long time coming together so we can bring California back to the greatness that it once had in the golden years, in our golden state, with our golden children. Because at the end of the day, that last keynote was so important. This is the original ounce of prevention that's worth the pound of cure. This is the opportunity for us to foreclose unemployment and welfare and, oh God, so many other unfortunate outcomes. To be 46th in per pupil spending and to be second in per prisoner expenditure makes it look like the people of California seem to think the most important thing is locking people up. When in fact, if we do a better job in preschool and child development, we'll have a smaller prison system, smaller welfare system, fewer unemployed Californians, and a much greater future. And I want to just say I loved Dowell's wonderful presentation. It was funny and it was very factual. But I differ with him on a little bit when he says the public doesn't get it. When the public gets asked point blank, Should we steal the money from First Five? This is Governor Schwarzenegger now. Should we steal the money from First Five to balance the state budget? The people of California said no by a 2-to-1 margin. They get it, and we should all get it. So we must find a way to work across these communities, across county lines, across the breaking down the silos of our departments, and work across the government of this state and the private sector of this state to the great future for all of our children. California is a wonderful state. I was born and raised here. And we are also a trendsetter. The old jingle, so sing my friends, be blithe, be gay, or weep my friends with sorrow. What California is today, the rest will be tomorrow. Let us return to the day when we were building great universities, great colleges, when we were building great K-12 systems, when we were one of the only 2 states that kept preschool after the end of Second World War. Let us together fight for every child from birth right all the way through graduate school. And if we do that, we will, in fact, be a better, more wonderful, more blessed place to be. So I'm excited today, then, to introduce 3 magnificent people who have joined together, who have come here to make this dialogue about how we work together. Yes, for the benefit of every child across the state. First, Tom Torlakson. Tom and I go way back. We've known each other since the buffalo roamed the plains. Tom was a teacher in Mount Diablo School District and subsequently was on the Antioch City Council, Contra Costa Board of Supervisors. He was in the Senate and the Assembly. And during his time in the legislature, he fought to protect education funding, as well as being active in closing the digital divide to eliminate the achievement gap. He also worked to reduce dropouts. As superintendent, he fought against Governor Schwarzenegger's use of school funding as a Sacramento piggy bank. And although money was taken from preschool and child development and K-12 and higher ed, it would have been worse if Tom hadn't been there. He's labored to improve high school graduation rates, and he gets the importance of developmental skills and developmental child development, I guess that's redundant, and has railed against cuts in this area. He worked hard to enhance safety nets and to say that every child that's falling behind should have a hand. He also worked to expand pre-kindergarten and after-school and summer school. Diane Dooley is Secretary of Health and Human Services Agency, appointed by Governor Brown in December of 2010. In that capacity, she chairs the California Health Exchange Board, serves on serves on a number of other boards and commissions, including the First Five Commission, the Child Welfare Council, the State Council on Developmental Disabilities, the State Mental Health Planning Council, and the California Workforce Investment Board, to name just a few. She's also president and CEO of the California Children's Hospital Association. She's worked with staff in the legislature and then went on to be a successful public relations and advertising agency leader. Subsequently, she was general counsel and vice president of the California Children's Hospital, Central California. George Halvorson has been introduced once, and he asked me to keep this brief. You know that he's been chair of our First Five Commission since May of 2013, and he's been the CEO of Kaiser Permanente. He's also received numerous awards for his leadership and achievement in advancing healthcare quality. And he's written several reform books, and I'm privileged to have just received Ending Racial, Ethnic, and Cultural Disparities in American Health Care. So with that, would you please welcome my wonderful esteemed colleagues to our podium.
Hello, everybody. Good afternoon. Can you hear me okay? Is the mic on? Yes. All right. Well, congratulations and thanks to First Five, your staff, your commission, your vision, and thanks for all the rest of you here to participate in such an inspiring and important topic. I appreciate Camille Maven. Was stolen from First Five from the California Department of Education. We miss you, but you're doing great things here. And Aaron Gable, likewise, was one of our stars. And thank you again for everything you're doing. As I start, I'll just mention the fun I had last Friday walking my 5-year-old grandson to the preschool. And then seeing the toddler brother having fun too, a 1.5 old. And what I saw is constant curiosity, endless inquisitiveness, yearning for learning. I was invited to the school to give these 4- and 5-year-olds a little lesson in what a leaf does in terms of taking sun energy and making sugar and making the plants that make everything work. So at any rate, I just marvel at the curiosity of young students. I'm so glad my grandchildren have the opportunity to have the reading, the talking, the singing in their home, so they have everything they need to get a good start in life. And I know in that background that we're all here because we want to see each and every child in California reach their fullest potential. And we know the steps that can accomplish that. And thank you for banding together. I know we're going to leave here with an action plan, an agenda, a homework assignment to really take some serious action together. We're in a very exciting time in education, but there's also a time of urgency. We've made much progress, but we have miles and miles yet to go. I'm optimistic about the changes that have been led by the governor, by the State Board of Education, by my department, by the legislature. We're working in a new and exciting, real-world connected way, better than we've ever done before. And the reforms and investments, amazing reforms and investments we're making in public education, are truly a smart investment, and they're targeted. It's bringing decision-making closer to the local level, your school district level, where you will be able to have an effective voice in shaping priorities, including health care for kids and the various opportunities in early learning. It is targeting low-income students. The funding formula targets low-income students and English learners, so they will get more to help address their needs and the gaps they have in being able to succeed. So these higher academic standards and these funding formula changes, to me, represent a great new opportunity. We're updating and transforming our curriculum and our way of teaching in ways that will meet the demands of the 21st century economy and actualize the potential in each and every single child. But these changes to be fully successful require our students to come to school prepared to learn. If they're hungry or unhealthy, as you've been talking about, if they're homeless, they will already be behind. And that's why in my first term, one of my biggest priorities was to reach and teach the whole child, and that is the same in this next 4 years. We're really working hard on that comprehensive approach to helping students thrive. Again, that means providing care, access to health care, and we've done a great job collaborating with Diana Dooley and the Secretary and agencies of the Human Services and Health Department to get all in. She'll tell you a lot about the successes of that program. It means reducing chronic absences and creating safe school environments with updated facilities, and helping families and neighborhoods meet challenges at home and in the classroom. It means expanding access to high-quality after-school programs and early learning programs and supporting parent education. And it means explaining and understanding the phrase, the word gap. You know, you've talked about that. What can we do about that? We know that oral language is closely connected to reading development. We know that by the age of 3 years old, children from low-income families, on average, hear 30 million less words than children whose parents have a higher education. So again, it sets out a huge challenge for this. How do we close the gap? Of course, parent education is key, and you've talked about that in this conference. Organizations like PICE, like Abriendo Puertas in Los Angeles, they're reaching parents and showing parents how they can help their child reach their fullest potential in a comprehensive way. And so again, reading, singing, talking to our students, this is part of that agenda. To close the word gap is really the foundation for the achievement gap, and we must close that gap working together. I've commissioned a major report on the whole child that's coming forward, and it'll be produced in April and shared with you in April on how my agency, the California Department of Education, is working to close that gap and to have, again, a comprehensive whole child approach. I'd like to just end with a couple of points, which is one, the huge potential you have for voicing your priorities, your concerns, bringing data, bringing information to the elected school boards around the state of California, where our investments in healthcare, our investments in early learning can be enhanced by the new monies that are there to help the targeted groups that we spoke of earlier. So be those advocates, be active, show up, be part of that process, and also mobilize your parent networks to do the same. Again, I want to thank the governor and the legislature and former Senate Leader Darrell Steinberg for really putting some focus and money back into early learning. We have 31,000 additional slots funded for the next few years. $250 million has been dedicated to that, including a rate increase, which was long, long overdue. We are going to be seeing just in the next few days Between the governor and the State Board of Education, myself, we advocated for applying for Race to the Top early learning money. We've got about $70 million in the first round, and the legislature's committed $50 million a year on an ongoing, and the quality rating improvement grants will be coming out very soon. Aaron, in the next few days, perhaps? We're hoping to have the good news announced of how that money is being invested. Finally, I'll say we all have a challenge on showing the public the good things that are going on and the interagency cooperation that's going on that can be even further expanded. But we went to the voters a few years ago in the middle of a crisis, and Prop 30 was passed. I believe that was the right thing to do. Again, as Delaine said, 46 in the nation is unacceptable in our per pupil spending. We're 46 in the nation. We can do more, we can do better with the great capacity of this state. So I urge you to stay tuned on how you can help us, because I believe we must go back to the voters and say, we spent the money well you entrusted with us, and we're going to address early learning in a comprehensive way that's going to have great dividends for children's success. But we need to find a way to have a son or daughter of Prop 30 or a revised investment plan that we bring back to the voters, because losing $7 billion a year will not help. The general fund will be very much crippled, and that will directly affect our child care programs and the other health programs we're working on together. So stay tuned, and I look forward to the rest of the panel discussion. Thank you.
Thank you, Tom. Diana, you're the next batter.
Thanks, Delaine. I so appreciate being a partner with Tom in the work that we've been able to do, bringing across lines of programs. As he so well said, kids can't learn if they don't have the social and health supports that are provided by the programs in the Health and Human Services Agency. We have just completed on Sunday, we will complete our second open enrollment in covered California. The Affordable Care Act has worked better here than in many other places, in part because of the work that is done in communities like yours that understand the importance of health and social supports. But the Affordable Care Act has done more than just bring coverage. It has also begun a seismic level shift in the way healthcare is delivered and the concepts that underlie it, which are very common to those in education that Tom was talking about in terms of whole child. We are really looking at whole person care and integrated care that recognizes that nutrition is a part of it, transportation is a part of it, housing is a part of it, poverty is a part of it. We have to bring all of the systems together around each person to create the environment for them to be successful, to learn, and to be healthy. And that can't all be done by government. It is done primarily in the communities that you are active in, and it's why groups coming together like this to learn from each other and to be inspired to go back and do all of the work that needs to be done. We're creating that here through work like the Health and All Policies with the Strategic Growth Council that is working to reduce greenhouse gases and deal with climate change, and recognize that a large part of that is in the communities through housing and transportation. And safe routes to school is a part of the work that we are doing there. The Health and All Policies is housed and led and managed at the Department of Public Health. 2 years ago, we had brought 45 very distinguished leaders around California together for a 6-month intensive effort in Let's Get Healthy California. We set a goal of becoming the healthiest state in the country by the year 2022. When we started it, I thought sort of naively that there were scores of things that we could measure. I quickly understood that there were hundreds of things that we could measure. And together we came up with a list of 39 indicators, and I think Dr. Burke mentioned the adverse childhood experiences, the ACEs, is a part of what we are measuring. That's one of our 39 indicators. And in addition to the things that you would expect, like infant mortality and vaccination rates, we're also looking at social determinants of health and health equity, which is an important overlay in all the work that we are doing with Let's Get Healthy. We have a robust effort at freeing the data and making data available across lines, both to the public and to the researchers and to the administrators that use the data to help you have what you need to help in communities. There is very great progress that we've made, but there is always more work to do. I worked for this governor when we were all much younger in the 70s, and then we were already with Medicare and Medicaid only 9 years old in 1975. We were already then in second round cost containment efforts. We've tried many things over 45 years, but healthcare costs just seem to keep escalating. And to make the priorities that we've talked about, we've got to spend less in some places if we're going to spend more somewhere else. We're working very hard to meet the triple aim, which was the goal of the Affordable Care Act: better health, better care, lower cost. And the lower cost is very hard to achieve. But we're working on that as well. And in those years between Brown 1.0 and Brown 2.0, I spent most of my life out of government, all of my life out of government, in the private sector, working in communities like yours in the Central Valley of California. Some of the poorest areas in California are in Tulare County, where I lived 26 years, and worked with food banks and domestic shelters and Rotary clubs and churches and local city councils and chambers of commerce to really make a difference in the lives of children. And we did make many, many differences in the lives of children there. And so as humbled as I am to have the responsibility that I have now to create the environment for change, I know that the real change happens in your communities and with your leadership and with your persistent effort day in and day out, making a difference in children's lives. And so to the governor's theme of subsidiarity, the notion that we really are the masters of our own destiny and the best decisions are made at the level that is closest to the place where it will be implemented. I am deeply committed to empowering people all across California to make Let's Get Healthy California the reality, and by whatever measure, be the healthiest state in the nation. And health by a definition that includes literacy and nutrition and transportation and housing and all of the parts of our lives that need to be integrated. So the theme of this conference, to bring us together and acknowledge the work that we do across lines, is critically important, and I'm delighted to be here to give my support. And you can be assured that in the 13 departments and all of the boards and commissions and the 33,000 state employees that work in the areas of my responsibility, that our North Star is better health in the broadest sense of that definition, that includes being in a condition that you can take advantage of the extraordinary learning opportunities that are created in our schools. So I'm delighted to be here and to engage in this conversation, and I look forward to the conversation.
And last but certainly not least, George from First Five.
Greetings. Very well said. Those were exactly the right paths to be going down in health. And creating a collective health agenda for California is critically important, and it's the right time to do that as well. We really are on the cusp of a golden age of insight and wisdom and learning and science on the brain development of children. We know things now that we didn't know a short while ago, and the things that we know now are extremely important. We know that in those first 3 years of life for each child, the neurons connect in the child's brain, and the children who get their brains exercised in those years end up with strong brains. The children who end up exercised in those years have vocabularies that are larger, they have greater learning ability, they do well in school, they don't drop out of school. In the future, they create a great workforce, they stay out of prison. And the children who don't get their brains exercised in those years, who are either ignored or they're isolated or they don't get the stimulation they need, end up not having the neuron connections that they need to go forward and succeed in their life. They literally are starting in a deficit. They're starting in a neuron connectivity deficit that basically they cannot overcome. And it's criminal for us to have any kids going down that path now that we know the science. We used to think that intelligence was sort of granted at birth, that the cards are dealt and you get your intelligence cards at birth. And we now know those cards are dealt in the first 3 years of life. And that we need to make sure every kid gets those cards dealt in a way that strengthens every child. And we need to create surround sound on that. That needs to be a public health campaign, a public health agenda. It needs to be a complete community awareness and shared wisdom. We need all of the parents, for starters, to know that. We've done a bunch of research, and most parents don't know that. Even the parents who are doing everything right are often doing everything right for cultural reasons or emotional reasons and not for the scientific reasons. And the ones who don't know that science are not doing the things that can be done in each setting to help their child. And it's talking, interacting, reading to the child that makes a difference and exercises the brain. It takes a direct adult interacting directly with the child. The new science tells us you can't get it from a television, you can't get it from an iPad. You have to get it adult to adult, adult to child. And when you get that direct connection, then the brains are strengthened. And most parents don't know that science. Almost none of the parents know that science. And we owe it to every parent to have every single parent know that science. We have an ethical accountability as people who know that information to share that information. We need to have every mother who gives birth in California understanding those issues and then able to make life decisions going forward in that context. And there are some lives that are very challenging, very difficult, and 2 jobs. As I said earlier, if you want to read to your child every night and you're working the night shift, that makes it really hard to do. And so there are challenges and difficulties, but even when there are challenges and difficulties, if the mothers know that information, if the fathers know that information, if the families know that information, if the daycares know that information, if the community knows that, then for each child, the likelihood of each child having a better path gets significantly better. And every child we save is a child we save. So we need to make the life paths better for each child by creating a surround sound on those issues in the community. We need the pediatricians on board with this agenda totally. We need the pediatricians. Over half the births in California are paid for by Medi-Cal right now. We need the pediatricians who are taking care of every child, whether it's paid for by Medi-Cal or not, teaching that science to every mother. We need the obstetricians doing that teaching in that last trimester when it's really a useful time, and you can begin educating your child. Now, the new science actually shows us that kids come out able to discern between different languages immediately after birth based on the languages they heard in utero. I mean, we now know, we used to think that learning started at kindergarten. We now know it starts at least a couple months before you're actually born. And so we need to have every parent understanding that. And so we need to have the hospital sharing that information. We need to have the obstetrician sharing that information. We need to have the pediatricians. And then when you reach out into the community, we need WIC to be able to share that information. WIC is doing a magnificent job in LA doing a pilot in that area, and the benefits from that are really solid. But if we have every family understand it, then families can both coach the mothers and the fathers and their families, but they can also provide that support. We need every daycare to know that. We need daycares reading. 61% of the daycares don't have a single book for low-income kids. We need books in the daycares. We need books in the homes. We need to make it easy, make the right thing easy to do. We need to make it easy for parents to read, and we need to convince parents that reading is the right thing to do. And if we do all of those things, we can change the trajectory of life for many children. And there are major learning gaps right now between groups of children. And those learning gaps are not created by anything genetic. Those learning gaps are created by the experience of each child in those first years when the brain is connecting. And if the children get the right exercise, they are on a different path than they don't get that exercise. And it's not about group, it's not about income level. A rich kid who doesn't get that exercise is going to have a challenge, and a poor kid who gets that exercise is going to have an advantage. It's not about income level. What we see, though, is that there are different behavior patterns by income level. The higher income parents are much more likely to talk to the kids. They're much more likely to have books in the home. There's all kinds of advantages that come from higher income levels, but those advantages come because of the interaction with children that happen in the homes of those income levels. It's not based on income, it's based on the behavior in the setting. And so we need to have everyone know that. So what we need to do is we need to teach that to everyone. We need to have it be part of the community wisdom and part of the culture. We need it to be part of an overall learning process. And then we need to go forward. And I'll close by, I think when we all know that, we are incredibly smart and creative people. California is particularly smart and creative. And when people understand what the opportunities are, people will start figuring out all kinds of ways of satisfying those opportunities, meeting those opportunities, and doing good things in creative, positive ways that will be synergistic in going forward. So we need to start with that goal. We need to figure out how do we get that information to everyone, how do we make that a common knowledge, and then how do we do the right things. And then when you kids get to school, they won't have that learning gap. They will come to school able to create the kind of workforce that California needs to continue to lead the world in so many things that California leads the world in. So I want to thank everyone who's here for coming to this meeting. This is an opportunity of shared collective learning. I really, really enjoyed the sessions. There have been some wonderful, wonderful speakers over the last couple of days, all teaching the kinds of things I'm talking about, creating a collective wisdom that we all need going forward. So thank you again, Camille, for a great conference, and thank you all for being here.
So I concur that I think this has been an amazing, wonderful event. But what do we do as individual agencies to keep the momentum, to keep this amazing collection of people who don't always find themselves in the same room together in the future? What can we do to keep the pencils together? Diana, you want to kick it off?
Well, I think that because the people who are here today have opportunities in their local communities, to George's point, making people aware of what's available. I think the local First Five commissions have extraordinary opportunity. I was general counsel at Valley Children's Hospital, and the First Five of Fresno was extraordinarily powerful in working across the lines to bring the needs of children to the attention of the Business Roundtable and the Chamber of Commerce and the Rotary Clubs. Lots of groups need speakers, lots of organizations. I was invited to be with Secretary Clinton when she came to Oakland to initiate the work that the Clinton Foundation is doing on the Talk, Read, Sing program. And it was so exciting to hear her passion, and there were about 20 of us there that day. And there were 2 cities in the United States that were piloting this program, Tulsa, Oklahoma, and Oakland, California. And to come here and see Read, Talk, Sing across and the buttons, and it's much broader than Oakland already, and that was just a few months ago. The WIC program that we have, the nutrition education programs that we have, the Child Welfare Council work. I can just rattle off 8 or 10 programs in my own direct engagement in the programs that we have in our agencies. There are so many opportunities for people to be ambassadors for the work that we need to do, particularly in the work of very young children. So I think the possibilities are really limitless, and it's very important to come together from time to time at groups like this because you do get inspired and you get energized and to think about ways that you can make it real. It's like going to church on Sunday and then living your faith all week long. This is coming to church on whatever day we are and living your faith as you go back into your community to be evangelists for the work that is so important to do for these very young children.
What do you think, Tom?
Well, I would say, just along with what Diana so well said, that stick together. We'll accomplish more by being stronger, your pencil metaphor. And we have great ways to connect to each other these days, digitally. So, connect to your networks, your professional network, your social network, your church affiliation, if you have that, and share what happened. Get an email together that's yours, that you can send to others, and they'll know it's genuine because it comes from you. And so I say we should share information, and as the Secretary develops initiatives on her health plans, as I, through the Department of Education, my great staff at the California Department of Education, have initiatives, we can get it into the network. I don't know, Camille, if you've thought about having, Camille Maven, having the First Five network that isn't call to action. It may be a particular call to get together with your local doctors. Is the CMA been involved? There's local, regional California Medical Association groups. A group of you in each region can go and ask them to provide the science that George was talking about, and so that they will take it on as an obligation as part of what they do in taking care of infants and toddlers from the very beginning. But again, stick together and stay informed and share in your own email networks and your own personal networks, and perhaps, again, the First Five can do a great service for us all by keeping us all connected digitally.
And George, do you have anything you want to add?
Yeah, I think we need to go to the pediatricians of California and get them all on board with this agenda. We need every single pediatrician talking to every parent about these issues, and we can help them. There's some really, American Academy of Pediatrics has produced some really good materials, and they've created some good materials on supporting reading, and we need to extend that to every California pediatrician because we need every child to know that. And we should look at the really brilliant programs that WIC and First Five of LA have put together to get to, because 60-70% of the Medi-Cal mothers come in and get counseling at WIC, and they get counseling on nutrition, and they get counseling on healthy eating, but they don't get counseling on brain nutrition. And they are highly trusted, they've got a great connection, and the mothers that they are coaching in the pilot are actually changing their behavior, and their children are ending up doing better relative to reading readiness and learning readiness as a result of that coaching. And WIC is everywhere, and so we need to look at those kinds of things, look at that study, see if we believe it, and if we do believe it, then extend it. But I think there are some leverage opportunities right now that exist that are actually relatively inexpensive, because you don't need to spend a lot of money to get the pediatricians to be coaching in this area. The hospital association should be in the loop. I think all of the trusted caregivers, because all of the parents, mothers in particular, really trust their OBs and trust their pediatricians. We did our testing, and the most credible source is the pediatrician for the mother. And so but that source hasn't been teaching this stuff in that window of opportunity that's absolutely prime for each child.
One of the things that I think sometimes people think is boring is data. But the fact is we have a lot of different data systems and they don't talk so well to one another. Are there suggestions you can make about how we could improve our cross-sector data systems to better communicate with each other, as well as to better serve the same families with the same data?
Well, I'll start with that, Delaine, because certainly medical data and health data, it's critically important that it both be protected and shared. And it has proved to be extraordinarily difficult as more and more electronic health records have been developed. There are both privacy and proprietary constraints. And I use that as an example because it has been so complex and very smart people have been trying to resolve it. The hospitals and physician groups that develop data, they develop it for their use with their patients, but they're not quite so interested in having their patients take that data and use it somewhere else. And so you have the proprietary issues of the investment in creating the data, and then what is used. The patients have to be empowered to use the data and want it, and we've got all of this cybersecurity. I mean, we just had this recent issue with Anthem, the extent of which we don't even know yet. And so it's very, very complicated, just in my area of health data. When you get beyond that into other kinds of data that are personal, it is very difficult to do. So that having been said, there is other data that we collect that we don't do anything with because it is kept inaccessible. And to that end, we have started an open data project starting with the Department of Public Health with some data sets that we have that we are working to make available to the public in ways that they can use it. We collect a lot of vital statistics from the counties. We collect a lot of quality data on the hospitals. There's a great deal of data that is collected that has not been made available. New York has made great progress in a free the data project. We are doing that here, and we are on our third release of data in the last 6 months. One of the things we're looking at is data for which we get frequent Public Information Act requests. Very often it takes us weeks to comply because the data is so difficult to unlock. It's not that we don't want to share it, it's just that it is all in different formats in different places. And I've learned a new word in data called metadata. Metadata is what we call the categories of data that you have to get agreement about in order to put the data in certain places that you know what you're looking at. I mean, I use my own email filing system as an example. I have my email, and most of it I delete, but some of it I want to save, and so I create a file for it. And then when I go to look for it, I can't remember what file I put it in. So maybe it was the name of the department, maybe it was the name of the project, maybe it was the name of the person. So just in my own personal life, I know how hard it is to collect and retrieve data. It is very important, and it has been a big priority of mine. Transparency is a high value, and I'm doing it across the board. George knows I've had tons of conversations about getting cost and quality data from the healthcare providers that we can use and they can use. So I am deeply committed, Delaine, to finding ways to unlock this data, many elements of data that we're required to collect that just sits somewhere, and it isn't available to the public, and it isn't available to us when we want to use it to either make a point or to follow up. There are any number of issues, but it is a big problem. It's hard to solve. But I am very committed, and my staff knows we're all working on getting our data more accessible across the lines. And that's just within my agency, but certainly working with education and the other programs of state and local government is very important.
Comment on use of data in healthcare. Kaiser Permanente completely automated all of its data. So it's a paper-free environment. All the information about all the patients is available all of the time. There's great research that's being done with that setting. But the thing that's fascinating is the most important use of that data isn't the megadata, isn't to have all the data about 500 people, it's to have all the data about one person.
Yeah.
It's the individual data, it's the focus on an individual that makes a difference. And I think for children, we need a similar thing. We need to know for each child the important information about that child. What do they need? And at Kaiser Permanente cut the stroke death rate by 40%, patient by patient, by identifying each patient who had relevant factors and interacting with that patient. And there wasn't some magical thing that was done across the entire population of stroke patients. It was a focus on each patient. And I think that same learning is important for children. I think understanding what the data circumstances, what the realities are for each child, and then figuring out what does that child need in terms of a development plan will be the best use of data.
Tom, you want to add anything?
I'll say ditto, ditto, and just add to it that in education, most of you parents know we have a CalPad system. We have a letter that's sent home. We're on a bit of a hiatus as we go into a new computer adaptive system for assessing academic knowledge and proficiency, but we'll see in 2016 we're going to have data to share, letters go home from me, outlining somewhere where the student's progress is noted, and we can also analyze that data to see how schools are doing, how cohorts of students are doing. So data can be very powerful and effective, and my department and I are very committed to sharing data as much as we can. I would also say that data is very important, again, in the local control funding process, because there is a local control accountability plan that districts must meet to show, school districts must meet to show that they're getting positive outcome for English learners, or positive outcome for kids in poverty, or positive outcomes for foster kids. And so the investments are made based on projected outcomes, but if the outcomes don't match what we hope for in the investment, we better change the direction of our investment. So data can be very powerful in that regard. Finally, there are a lot of studies, as George underscored, that are already out there, that 90% of brain development occurs in the first 5 years. So using that data, sharing that data that already exists in powerful settings and powerful ways is really important.
Given the limitations, and I'm supposed to land here soon, but given the limitations, would you all, though, be willing to make a commitment to find some common data indicators that we could use more powerfully in the state of California to understand, protect, yes, the student's identity, but to understand what we are doing and what kinds of success or failure we're having, and how we can move the needle more for the children that are currently in California and those who are yet to be born? It would be great if we could put together maybe some kind of a team where we could, what would be the vital information we could share in a way that protects people, but nonetheless safe and secure, but nonetheless it helps everybody to have the information they need.
That's precisely what we did with Let's Get Healthy 2 years ago, almost 3 years ago now. We came together, scores and scores of possible data sets, and agreed on 39. And we're now reporting them every November or December each year. We've come out with the updates on the scores. And I really do believe what you measure matters. And we have to know where we are. Accountability is critically important. So I'm absolutely committed to being a part of an effort to find what those handful of measures would be that we can use to hold ourselves accountable. It's not easy work to do that. Who you get in the room and who you report to and how it happens is all much easier said than done. But I am certainly committed, Delaine, to working with whoever we need to pull together and get some agreement about who would use the data and what is it that they need to do. So I'm in.
I'm in.
Good,
Also,
wonderful. Bravo. And in general, could we call on your three agencies to use this not as an ending place, but as a jumping off place, where we foster greater collaboration, cooperation between all three of these vital agencies for the future of the state of California and this children?
Well, I'll also say I was delighted when George accepted the governor's invitation to chair the State First Five Commission. I think he is an extraordinary career and a great leader, and I think that the leadership that First Five has provided certainly could be the convening instigator. Camille, you know, go get them. But I think you have the leadership and the will and the structure through the local First Fives and the leadership of the state First Five to pull together the people that you would need to do. And I would certainly do anything I could to support that.
we would accept that.
And likewise, I'm an old cross-country and track coach, and the team theme is, how do you spell team? T-E-A-M. What's that stand for? Together, everyone accomplishes more. So we're going to get a lot more done together, just as Diana said. And Camille, help us convene, lead the way. George, we look forward to working with you.
And it's a perfect role for us to be involved in to help convene, and thank you. We accept.
Great.
And I guess, bravo. And last but not least, I hope we can all agree that we will work together to share First Five's goal that every parent and caregiver gets more information about this brain science. It's not new. It's really been around for a while. But way too many people do not know just how powerful it is, that what happens in the first 5 years, that 90% of brain development is determined by those first 5 years. This is not new information, but for some reason it isn't widely enough understood. And we must, since we have not only the highest number of poor kids, but the highest percentage of poor kids, this is a game change. California really is a trendsetter, and I think we could really move the ball this time because of First Five, because there are can-do people on this platform and have been at this conference the entire 3 days. And I just would love to see us say, now we're getting somewhere. Next year's meeting and the year after that's meeting. Now we're getting somewhere.
Yep.
Everybody in?
Yes.
Everyone.
All right.
We need.
Thank you all very much. Please thank our panelists. Any closing comments anybody want to make?
I was just going to say, we need every single mother who gives birth in California to know this, and we're going to work really hard to put together an agenda to make that happen, and I think the goal should be 100%, and I think it's doable. And so, yes, definitely, let's move in that direction.
Thank you
Great.
all. You've been marvelous, really.
Thank
Great
you.
conference. Thank you, Camille.
Always great, Diana.